Welcome to Trending Unpack, the show that dives into what the world's been searching for and why it matters. For today's deep dive, we're unpacking a fascinating evolution in healthcare,
Yeah.
one that feels decidedly modern, almost luxurious maybe, yet it's rapidly reshaping our expectations for medical care. We're talking about personalized healthcare and specifically a rising buzz around a very particular role within it, one that promises convenience, a unique level of attention, and, a new way of approaching recovery and wellness. It's really quite a transformation of a traditional service.
Yeah, what's truly intriguing here is how a long-standing medical role is being reinvented. It's challenging our conventional notions of where and how medical care is delivered. So our mission today is to explore the world of the concierge nurse, understanding precisely what they are, who is utilizing their services, the pretty comprehensive scope of care they provide, and crucially, what this burgeoning trend signifies for the future of healthcare access and its delivery, globally. We'll delve into whether this is a genuine step towards broader personalized care for everyone, or maybe, just maybe, a luxury that remains reserved for an elite few. It's a nuanced landscape for sure. We'll try to unpack its many layers.
All right, let's begin at the very foundation then. When we hear nurse, we typically think of a hospital setting, maybe a traditional home health agency. So what exactly is a concierge nurse, and how does this role truly distinguish itself from those more familiar models? Like, what's the core difference?
Right. Well, the core difference really lies in autonomy and the direct patient-provider relationship. A concierge nurse is, first and foremost, a highly qualified registered nurse, an RN. And that licensure is absolutely key, okay? It signifies a rigorous level of education, clinical training, and the legal authority to perform complex medical procedures. But, and this is the crucial bit, unlike an RN employed by a hospital or dispatched by a large home health agency, a concierge nurse is hired directly by patients or their families.
Directly, so like a private contract.
Exactly, a private contract. And this direct setup enables a profoundly customized one-on-one care experience that is, simply not feasible in a traditional institutional setting. Think of it this way. In a hospital, a nurse might be juggling, 5, 6, maybe even more patients simultaneously, each with their own urgent needs, right?
Yeah, totally overloaded usually.
Precisely. They're adhering to strict shift schedules, working within predefined hospital protocols, dealing with all sorts of administrative stuff. A concierge nurse, by contrast, dedicates themselves entirely to one individual. They tailor the entire experience to that person's precise medical needs, their personal preferences, and the environment they choose for recovery.
So not just in a hospital.
Not at all. The care can be delivered in the comfort of their own home, maybe a private hotel suite, or even one of these specialized, discrete recovery centers that are popping up. This direct, dedicated model, sometimes it's called private duty nursing, it emphasizes that singular, uninterrupted focus. It provides a level of personalized attention that traditional systems just aren't designed for.
Okay.
It's really about bringing the care to the patient on their terms, instead of the patient having to adapt to the system's schedule and environment.
I could definitely see the huge appeal there. It sounds like a much more intimate, deeply patient-focused experience than what most people get in a busy hospital.
Yeah.
That distinction really highlights a new paradigm in care, doesn't it?
Yeah.
I'm really curious then, how does that actually play out in terms of the duties and responsibilities compared to, say, a hospital nurse or even a home health aide? Is it similar duties, just with a different pay structure? Or is the actual scope of care fundamentally different?
That's a really insightful question because the scope of care and the patient experience are profoundly different. It goes way beyond just a pay structure change. Let's break that down a bit. Okay, consider the traditional in-hospital nurse. Their environment is dynamic, often, let's be honest, chaotic, right? They're responsible for a high patient load, managing multiple admissions, discharges, meds on a strict schedule, responding to emergencies, mountains of documentation, coordinating with tons of staff. Their care is often reactive, dealing with acute needs as they pop up, and their attention is, necessarily divided. They're incredibly skilled, no question, but sustained one-on-one time, it's just limited by the system.
Right, the sheer volume.
Exactly. And their work is bound by pretty rigid hospital protocols. Standardization is key there, but maybe at the expense of individual customization sometimes. Now, a concierge nurse operates with a totally different rhythm. Their focus is proactive, it's uninterrupted, and it's deeply personal. They have the luxury of time to anticipate needs, to really engage in patient and family education, offer real emotional support.
That sounds invaluable.
It really is. They can monitor subtle changes because they're observing only that one patient without constant interruptions. This allows for a much deeper understanding of the recovery process, more tailored interventions, a truly holistic approach. They're not just managing symptoms, they're supporting the whole recovery journey.
Okay, so that's the hospital nurse difference. What about compared to a home health aide? Because people might confuse those roles.
Yeah, that's a critical distinction, and it really boils down to training, licensure, and scope of practice. Totally different things. Home health aides are absolutely indispensable, don't get me wrong. They help with activities of daily living, bathing, dressing, meals, light housekeeping, companionship, crucial support for independence at home.
Right, the non-medical support mostly.
Exactly. They are not medically licensed to perform clinical tasks. They can't give meds, change complex dressings, or do medical monitoring. A concierge nurse, as a licensed RN, has a vastly expanded scope of practice. This is where the real medical side comes in.
Okay, so what kind of medical tasks are we talking about?
We're talking advanced stuff right in the patient's home. Administering intravenous medications IVs, that could be antibiotics, complex pain management drugs, you name it, performing intricate wound care, managing post-surgical drains, maybe using specialized negative pressure therapy for really tough wounds, carefully checking for infection.
Wow, okay. That's pretty advanced for at-home care.
Absolutely. And conducting continuous, detailed medical monitoring. Hourly vital signs, assessing neurological status, checking how meds are working, side effects. They essentially bring a hospital-level clinical skill and assessment capability right into the patient's chosen space. It's a robust medical presence, far beyond just basic comfort. It's sophisticated medical expertise in a private setting.
That's a powerful differentiation. It really highlights how this blends that high-level medical necessity with, well, a unique kind of personal service. So it does sound like a blend of, real medical need and a significant lifestyle choice for those who can access it. Given that specialized high-level care, who exactly is seeking these services out? Is there a common thread, or is it surprisingly diverse?
It's truly a fascinating mix, actually, a real cross-section of needs and circumstances. It's that blend you mentioned, medical necessity, convenience, and yeah, often a clear lifestyle choice, too. We see several primary groups driving demand. One very prominent group, maybe unsurprisingly, is affluent families. For them, the big drivers are discretion, convenience, and getting dedicated, high-level medical attention without, the public exposure of a hospital.
Privacy is key.
Absolutely paramount. They want to integrate care seamlessly, almost invisibly, into their lives. Think maybe a high-profile person needing post-op care quietly, or an elderly relative needing constant watching without leaving their home. Another really rapidly growing area is postpartum mothers. That time right after birth, it can be overwhelming.
Oh, definitely.
New moms need support with newborn care feeding, lactation help, sleep training, plus their own recovery. Wound care after a C-section, pain management, emotional support. Having a skilled RN right there at home, it can be transformative, lets them rest, bond, recover without the stress of clinic visits or trying to figure things out alone.
I can imagine. Like having an expert on call 247.
Pretty much. They address concerns on the spot, offer guidance, provide that calm reassurance. It's huge for new parents. Then you have post-surgery recovery patients. After major surgeries, orthopedics, abdominal stuff, complex procedures, patients need meticulous wound care, pain management, help moving, constant monitoring to prevent complications like infections or clots.
And doing that at home must be preferable to a hospital ward for many.
Massively. Recovering in a familiar, comfortable setting away from hospital noise and risks, it can really enhance healing, reduce anxiety, maybe even lead to faster recoveries, fewer readmissions. And a particularly growing niche, one we see a lot on social media, is cosmetic procedure aftercare clients.
Yes. I've seen some of that online.
Right. After aesthetic surgeries, patients want discreet, professional care for swelling, bruising, pain, managing drains. A concierge nurse provides specialized stuff, maybe lymphatic massages to help with swelling.
Lymphatic massage. Okay, what's that exactly?
It's a specific, very gentle type of massage. It aims to stimulate the body's lymphatic system, which helps drain excess fluid and reduce that post-surgical swelling. Accelerates healing, can even improve the final look. So the nurse helps manage all that, controls pain, checks wounds carefully. The goal isn't just recovery, it's optimizing the aesthetic outcome, privately.
Makes sense for that clientele. Any other groups?
Yeah, elder care is another big one. Concierge nurses provide a really high level of medical support there. Careful medication management, especially with complex regimens. Proactive monitoring for subtle health changes. comfort care. It allows seniors to age in place with dignity, keeping their independence but getting top-tier medical attention. Can prevent hospitalizations for things manageable at home with good oversight.
Like managing dementia-related issues or preventing falls.
Exactly. Constant supervision, medication reminders, watching for side effects, things that need dedicated attention. And finally, there's travel health support for people needing medical oversight while traveling business, vacation, maybe going abroad for treatment.
So like a medical escort.
Could be. Or monitoring vitals in a hotel, managing meds on the go, ensuring care isn't interrupted, offering peace of mind wherever they are. It's about health, not limiting mobility. So, yeah, quite a range of needs driving this.
It's clear this service addresses a very specific set of needs, often where traditional systems might fall short on that comfort and privacy aspect. That brings us to something you touched on, the influence aspect. When public figures or, people with significant resources embrace this, it inevitably makes an impression. How much of this trend's growth do you think is genuinely fueled by that influencer effect, seeing high-profile clients not just use but sometimes openly glamorize these services online?
Oh, it's absolutely undeniable. The visibility from influencer clients plays a huge, maybe even transformative role in popularizing and normalizing concierge nursing. What we see on platforms like TikTok and Instagram, it isn't just random chatter, it's powerful, visually driven, aspirational marketing, basically. When public figures, celebs, reality stars, even those micro-influencers with dedicated followings openly show their recovery with a concierge nurse, it fundamentally shifts how people see it.
Moves it from niche to desirable.
Exactly. From obscure and exclusive to something that looks not just desirable, but almost aspirational. And in that curated digital world, it can even seem weirdly attainable, even though it isn't for most. The appeal is strong. These stories often highlight avoiding stressful public hospital environments. They emphasize privacy, the seamless integration of top-tier medical support into, often, a luxurious life.
Right, the contrast is stark. Hospital gown versus designer pajamas at home.
Pretty much. Instead of crowded waiting rooms or shared rooms, you see this professional discreetly managing recovery in a gorgeous, aesthetically pleasing personal space. It makes it look not just convenient, but part of a high-end lifestyle. And the way it's often presented, filtered, soft lighting, it makes recovery look almost effortless, totally removed from clinical starkness.
So it fuels demand among those who can afford it and aspire to that level of care.
Absolutely. It becomes less about being sick and more about optimized wellness, lifestyle enhancement. It's a powerful narrative.
So going back to actual care, it really isn't just about comfort, as you said. These nurses are performing complex medical tasks. Let's dive deeper into the specifics again. What exactly are the clinical capabilities? We touched on IVs and wound care, but let's get into the nitty-gritty.
You're right to keep emphasizing that. This is rigorous, serious medical care. The clinical capabilities are really extensive, reflecting that RN license and often specialized training. So IV therapy, yeah, it's common, critical. And it's way beyond just simple hydration. It's administering a wide range of IV meds, potent antibiotics, anti-nausea drugs, complex pain management infusions, even those tailored vitamin drips for wellness or recovery.
Which means patients don't have to trek to a clinic for every dose.
Exactly. Huge convenience, better continuity of care. Then wound care, again, highly skilled, much more than basic bandage changes, managing complex post-surgical incisions, dealing with surgical drains, those tubes removing fluid buildup.
Drains can be tricky to manage at home alone.
Very. And they might even operate advanced systems like vacuum-assisted wound therapy that uses suction to help heal chronic or complex wounds. They're constantly monitoring for infection signs, assessing tissue, ensuring optimal healing. It can really prevent readmissions.
Okay, what else is core?
Medication management and administration. Absolutely crucial. Ensuring strict adherence to schedules, correct dosages, tricky with multiple meds monitoring for side effects, and really educating patients and families about their regimens.
Reducing errors must be a big benefit.
Huge, especially for older patients or those with complex conditions. Having that dedicated oversight makes a massive difference to outcomes. And critically, post-operative monitoring. After surgery, you need vigilant observation. Concierge nurses do continuous vital signs, blood pressure, heart rate, oxygen, temp. They assess recovery progress, monitor pain levels.
And looking for complications early, I assume.
That's perhaps the most important part. Identifying potential complications early, Subtle signs of infection, internal bleeding, blood clots like DVT, adverse reactions to meds. Their constant dedicated presence means subtle changes that might get missed during quick home visits or in a busy hospital ward are more likely caught fast. Allows for rapid intervention, coordination with the doctor, can prevent emergencies. They bring high-level clinical surveillance right home.
That's an incredibly comprehensive list. And beyond those core duties, you mentioned even more niche services, postpartum, cosmetic aftercare, travel. How do those differentiate themselves? What's the specific expertise there?
Yeah, this is where that customization and deep specialization really shine. Targeted expertise for unique situations. For newborn support, it's way beyond just basic baby care. It's comprehensive guidance on feeding schedules, breast or bottle, expert lactation help for common issues, establishing sleep routines, invaluable for exhausted parents.
And education, too.
Absolutely. Vital parental education on diapering, swaddling safely, recognizing common issues like colic, reflux, signs of illness. It's like having an expert, calm guide through those overwhelming first weeks. Reduces anxiety, promotes healthy development. In cosmetic procedure aftercare, the services are super specialized, focused on optimal recovery and the aesthetic outcome. We mentioned lymphatic drainage massages to reduce swelling and bruising.
Enhancing the final look.
Exactly. They also manage drained expertly, use advanced pain control strategies, specific interventions to minimize bruising, scarring. The nurse's role is unique, ensuring physical healing and actively working to enhance the cosmetic result, all privately. And for travel health support, it's about seamless medical oversight during a journey. Accompanying on flights, managing complex meds precisely, handling unexpected health issues, coordinating locally if needed. Huge peace of mind.
So ensuring medical needs don't stop someone traveling.
Pretty much. Turns a potentially stressful medical journey into something comfortable and well supported no matter where they are.
It's clear it's not just the what they do, but very much the how. That holistic, personalized aspect, the white glove experience you mentioned earlier, seems like a massive draw. It really sounds like they're creating a completely bespoke care environment. Can you elaborate a bit more on that specific aspect?
Precisely. The white glove experience isn't just a bonus. It's intrinsic. It defines the model. It goes beyond the clinical tasks to the whole approach, prioritizing unparalleled comfort, convenience, peace of mind for the patient and their family. In traditional settings, care is often dictated by institutional schedules, staffing, protocols, right? Patients often feel they have to adapt to the system.
Yeah, wake up at 6 a.m. for vitals, whether you like it or not.
Exactly. With a concierge nurse, the experience is designed around the patient's life. Schedules fit their routine, their sleep, their preferences, not the other way around. It means the nurse is often on call, providing immediate access to advice, reassurance, or intervention. That hugely reduces anxiety during a vulnerable time.
It's like having a safety net right there.
A highly skilled one. It's intensely patient-centric. The nurse becomes a dedicated advocate, a partner, a constant calm presence. They have time to really listen, explain things clearly, offer deep emotional support, things often squeezed out in busy settings. Imagine recovering from major surgery. Instead of hospital noise, you have someone dedicated solely to your comfort, anticipating pain, getting water, adjusting the room, explaining everything, just being there.
That sounds incredibly reassuring.
It transforms the experience. Recovery feels less like a clinical necessity to endure and more like a supported, comforting journey in your own space. It really redefines what medical care can feel like, elevating it to bespoke wellness.
It really feels like the pandemic pushed us all to reconsider how and where we get healthcare. The surge in these services seems directly tied to that. So let's talk timing. When did this trend really kick into high gear, and what were the main catalysts?
You're absolutely spot on. The COVID-19 pandemic was this huge, unprecedented catalyst. It dramatically accelerated demand for all kinds of at-home medical services, and concierge nursing specifically. Before the pandemic, yeah, private nursing existed, but complex care outside a hospital, still pretty niche for most people, often linked to end of life or very specific long-term stuff.
But COVID changed that perception.
Fundamentally. The strains on hospitals became obvious, overwhelmed, scarce beds, stretched staff, and at the same time, everyone became hyper-aware of infection risks in clinical settings.
Right, avoiding hospitals if possible became a priority for many.
Exactly. People were scared of crowded waiting rooms, shared spaces, especially if recovering or immunocompromised. This combo created fertile ground for concierge nursing to just explode. Suddenly, it looked like a viable, attractive, and often safer alternative. There was this widespread increase in comfort, even preference for getting medical services at home. Patients saw the benefits. Avoid ERs, reduce infection risk, recover in a controlled personal space.
So the pandemic kind of normalized the idea.
Completely. It normalized the idea that high-quality professional medical care doesn't have to happen within institutional walls. For many, home became the preferred, less anxiety-inducing place to heal. That shift in mindset and necessity really propelled concierge nursing into the mainstream of private options.
And geographically, where are we seeing the biggest boon for this? Is it global, or are there specific hotspots? And why those places?
While the idea is gaining traction internationally, the sources point to the main hotspots being pretty concentrated: the US, the UK, and Australia. And within those countries, it's especially pronounced in the major cities. Think New York, London, Sydney, Melbourne. These places have a specific mix of factors making them ripe for this.
Like what kind of factors?
Well, firstly, a significant concentration of wealth and high disposable income. Let's be frank, concierge nursing is premium, mostly out of pocket. These cities just have more people who can afford it and are willing to pay.
Okay, so the money's there. What else?
Secondly, these countries generally have robust private healthcare sectors alongside public systems. There's already an ecosystem and cultural acceptance for private fee-for-service models. It makes integrating direct-to-consumer nursing easier. And lastly, there's just a really high demand for convenience, privacy, and personalized services in these fast-paced, often high-stress urban centers.
People willing to pay a premium to save time and hassle.
Exactly. Avoiding hospital visits, waiting rooms, getting services that fit seamlessly into demanding lives. For a busy exec or public figure, discretion and time saving are hugely valuable. So it's kind of a perfect storm. The money, the existing private infrastructure, and strong consumer desire for convenience and bespoke experiences. These cities have both the supply of nurses looking for alternatives and the demand from clients seeking premium health solutions.
If we connect this to the bigger picture, as you said, it really suggests a major shift with more services moving into the patient's preferred space. How do analysts see this long term? Is it just a fad, or is it really seen as a stepping stone towards something much bigger in healthcare's evolution?
Analysts are pretty much unanimous on this. They definitely don't see it as a temporary fad. It's overwhelmingly viewed as a crucial stepping stone toward a much broader, more fundamental shift: the continued growth of at-home care models. It's part of a larger systemic move towards more decentralized health support, moving more services out of traditional institutions and into the patient's home or chosen private setting.
A trend the pandemic just accelerated, maybe.
Precisely. It sped up something already simmering, a deep desire for healthcare that's more convenient, less intimidating, more tailored. Concierge nursing embodies this future. It shows it's feasible and desirable to deliver high-level care complex SOVs, post-op monitoring, wound care right at home. It proves complex stuff can be managed safely and comfortably outside hospitals for many conditions.
What could be the broader implications of that?
Well, potentially shorter hospital stays, maybe fewer readmissions, because patients get better support recovering at home. A future where more diagnostics, therapies, recovery services happen at home could be common. Ultimately, it's about creating a truly patient-friendly landscape, driven not just by tech, but by reorienting towards individual needs, comfort, preferences.
Yeah.
Healthcare integrated into daily life, not separate and daunting.
So shifting gears slightly, back to the social media aspect, it's not just care, it's become content. And it makes something very medical seem almost aspirational, even glamorous.
Yeah.
Let's talk about social media's role again. How exactly is it being portrayed and amplified on TikTok, Instagram, places like that?
Yeah, the social media angle is fascinating and pretty powerful. TikTok and Instagram are prime channels, especially under that hashtag concierge nurse. It's often highly curated, visually driven, aspirational stuff. You see a lot of aesthetic setups videos showing these luxurious, comfortable home recovery spots. Plush beds, perfect linens, serene lighting, elegant decor, making recovery look calm, beautiful, desirable. A huge contrast to a sterile hospital room.
Like an Instagram perfect recovery.
Exactly. Then there are behind-the-scenes recovery snippets. They feel intimate, exclusive, but they're not raw portrayals of discomfort. They're often visually appealing, maybe sped up. You see the nurse giving a flawless IV, changing a dressing precisely, maybe a gentle massage, always emphasizing comfort, professionalism, seamlessness in a luxury setting.
The recovery glow up.
That's a good way to put it. Makes the process look effortless, elegant. And, of course, the most impactful content often features the influencer clients. When public figures share their experiences, it powerfully normalizes private, at-home care, and it glamorizes it. It subtly suggests this is the ideal, maybe even expected way to recover, a sign of prestige, self-care, a coveted lifestyle. It turns a medical need into a lifestyle choice others might aspire to.
That raises a really important question, doesn't it? What message does it subtly or maybe not so subtly send about illness and recovery when it's constantly filtered through this lens of luxury and curated aesthetics? There has to be a potential downside to this glamorization.
Oh, absolutely. There's a significant downside, and it's a crucial ethical point. This glamorization has several big implications. Firstly, it definitely helps normalize certain cosmetic procedures and types of care by showing the seemingly ideal, comfy, seamless recovery. When you see an influencer bounce back effortlessly with a private nurse, it can subtly minimize the risks, discomforts, the seriousness of the procedure itself.
Setting unrealistic expectations for others.
Totally. Leading to disappointment or frustration if someone's own recovery without that support doesn't match the idealized version. It glosses over the often tough reality. Secondly, and maybe more subtly, it creates these aspirational perceptions of recovery as a luxurious, almost spa-like thing. This can inadvertently send the message that illness or recovery should be comfortable, private, effortless.
When for most people, it's really not like that at all.
Exactly. For most, it's difficult, messy, vulnerable, often public within the traditional system. It presents this filtered reality that makes the standard hospital or clinic experience, shared rooms, waits, less attention feel inadequate, undesirable, like a failure by comparison. The danger is widening that gap between expectation and reality for the average person. Fostering inadequacy if their journey doesn't look like the aestheticized versions online. It subtly reinforces the idea that comfort, privacy, optimal healing are commodities exclusively for those who can pay, not universal rights or parts of healthcare itself. It risks eroding trust in universal systems by showing an unattainable gold standard. It creates a visible class of health privilege.
So what does this all mean for the vast majority who can't afford a private nurse? Is this genuinely personalized care paving the way for all, or is it just for the privileged few? It really does sound like it could worsen healthcare inequality, creating that two-tiered system.
You've hit the absolute heart of the ethical dilemma. And yeah, it highlights existing disparities starkly. On one hand, concierge nursing, purely as a model, is the epitome of personalized, patient-centric care. Tailored, comfortable, showing what bespoke healthcare could be. However, its cost, being mostly out-of-pocket, raises serious, unavoidable concerns about exacerbating a two-tiered system. It suggests a reality where optimal individualized care, comfort, privacy, proactive benefits becomes exclusive to those with significant financial means.
So one person gets continuous care at home, another gets intermittent care in a busy ward for the same condition.
That's the potential reality. One might have a faster, more comfortable, complication-free recovery purely due to access driven by wealth. It forces us to ask, does this contribute to an elite healthcare system? It creates a segment with superior access, privacy, often better outcomes, while the broader public navigates strained systems that just can't offer that dedicated attention. Knowledge, optimal care, they're most valuable, universally applied, right?
Yeah.
But this model creates a huge financial barrier, potentially widening the gap between the healthcare experiences of the rich and everyone else. Challenges our ideals of equitable access, it's uncomfortable.
And beyond access, when complex medical care moves out of highly regulated places like hospitals, how do we ensure quality, safety, accountability? Are there big challenges with regulation and oversight here?
That's another absolutely critical point. And yeah, it poses a substantial evolving challenge for regulators. When care shifts from structured regulated institutions to decentralized private homes or centers, the established frameworks for regulation and oversight get trickier, less defined. Right now, there's often a lack of standardized, specific regulation for concierge nursing practices across different places, even within the same country. Individual nurses, yes, they're licensed, governed by nursing boards ensuring basic competence, professional conduct, but the business model itself often falls into a regulatory gray area.
So they might not face the same inspections or reporting rules as a hospital or even a big home health agency.
Often, no. Not the same stringent operational oversight, facility checks, patient safety reporting requirements. This raises concerns. How do you ensure consistent quality across different individual nurses or small agencies? What ensures robust patient safety standards at a private, less scrutinized setting? What happens if something goes wrong? Where's the clear recourse beyond the nurse's professional board?
So the burden falls heavily on the patient to check things out.
Hugely. Patients need to do really thorough due diligence, verify credentials, current license, good standing, ask about specific experience for their needs, get references, check for professional liability insurance. Without a unified regulatory body for these services, patients have to be exceptionally vigilant. The consumer bears a significant burden in vetting their provider.
What's really fascinating, as you mentioned, is that this isn't just about patient demand for luxury. It's also a response to pressures within the existing system, which raises that question. Is this a sustainable solution for nurses seeking better work, or more a symptom of larger systemic issues pushing them out of traditional roles? This brings to mind nurse burnout. Is there a direct connection? Are nurses actively choosing this because of the challenges in hospitals?
You've absolutely nailed a pivotal driver here. The rise of concierge nursing is significantly fueled by, well, growing disaffection among RNs with the tough, often unsustainable conditions in traditional hospitals. Nurse burnout isn't just a buzzword, it's a real widespread crisis. Emotional exhaustion, depersonalization, feeling ineffective. The causes are well known: crazy high patient ratios, compromising care, overwhelming admin work, taking time away from patients, long, draining shifts.
And feeling like they can't give the care they want to give.
Exactly. A pervasive feeling they can't provide the quality of care they trained for due to systemic constraints. For many RNs, moving to concierge nursing looks like a compelling escape route, a significant improvement in professional life, well-being. It typically offers way more flexible hours, better work-life balance, often impossible in hospitals with rigid schedules, mandatory overtime. There's also often better pay potential. They're compensated directly for specialized skills and dedicated time, bypassing potentially lower hospital pay structures. Big financial incentive.
But is it just about hours and pay?
No, perhaps most crucially, it allows for far more direct, meaningful patient interaction without that crushing administrative burden. Hospital nurses spend so much time charting on paperwork, EHRs, coordinating non-clinical tasks. In a concierge role, they focus almost entirely on the patient, providing that deep, one-on-one, attention, holistic care they entered nursing for. It offers autonomy, professional satisfaction, practicing nursing aligned with their ideals, things often eroded in high-pressure, understaffed hospitals.
So it is a solution for individual nurses then?
Yes, unequivocally a solution for individuals seeking a more fulfilling, less stressful, potentially more lucrative path. But simultaneously, it highlights and acts as a powerful symptom of those profound systemic issues, staffing shortages, admin overload, burnout, that are actively pushing skilled nurses out of the very public infrastructure meant to serve everyone. It's a clear, concerning sign of a much bigger unresolved problem in how we value and retain our nurses.
This all sounds incredibly appealing then. For the patient wanting personalized care, for the nurse wanting a better environment.
Yeah.
But as we've noted, there's that significant price tag. Can you give us a clearer sense of the cost? What are the typical ranges, and what pushes that price up or down?
Right. The cost is a major factor, and yeah, it's definitely not accessible for everyone. Sources consistently show a pretty significant range, typically somewhere between, say, $150 to upwards of $500 per visit or per day, sometimes even more. And it's a broad range because the final cost depends on several key things.
Okay, like what?
Firstly, the specific services needed. A quick wellness IV or basic vitals check, that'll be at the lower end. Complex wound care, extensive post-op management needing lots of interventions, 247 critical care. That'll push costs way higher, maybe thousands per day or week. More specialized, intensive, time-consuming care costs more. Secondly, the nurse's experience and specialization. A highly experienced RN with advanced certifications, critical care, wound management, specific surgery recovery will charge more than a generalist. Niche specialists, like in cosmetic aftercare or complex peds, often command higher rates due to rarity and demand.
And location matters too, I bet.
Huge factor. Geographic location. Services in big cities like New York, London, Sydney, definitely more expensive than in smaller cities or rural areas. Higher overheads for the nurses, higher cost of living, concentrated demand from affluent clients there. Local market rates play a big role. And finally, the duration and consistency of care. A one-off visit is different from needing someone hours a day for weeks or continuous around-the-clock care. Some offer hourly rates, others daily, weekly, monthly packages, maybe with discounts for longer commitments. But bottom line, it consistently remains a premium service.
Which brings us straight to insurance. Often the gatekeepers for most people's health care. Is any of this covered by standard health insurance, or is it pretty much always out of pocket?
Critical point. And yeah, it ties right back to that inequality discussion, the stark reality. Concierge nursing services are typically, almost universally, not covered by standard health insurance plans. So, for the vast majority using these services, it is predominantly, if not entirely, an out of pocket expense.
Why is that? Why won't insurance usually cover it?
While traditional insurance models, public or private, are built to cover services within established networks or through approved home health agencies meeting specific medical necessity criteria, defined pathways, standard billing codes. Concierge nursing operates outside these conventional frameworks. Insurers often see it as a premium or convenience service, not strictly medically necessary under their rigid guidelines.
Even if the tasks are medically necessary, like IV antibiotics.
It gets tricky. Certain components might be covered the drug cost itself if prescribed, maybe specific supplies billed separately through a pharmacy, but the substantial service fee for the nurse's direct time, expertise, dedicated presence, that almost always falls outside standard coverage. This massive financial barrier is precisely why it remains primarily accessible to those with significant disposable income, reinforcing that two-tiered system. It makes the value proposition a very personal, very significant financial calculation for the client.
It truly becomes a question of what immense value patients place on those intangibles. The convenience, the privacy, the dedicated attention, the peace of mind when making that financial decision.
Yeah.
So ultimately, as we look ahead, is concierge nursing this innovative stepping stone toward a broader vision of personalized medicine for everyone? Or is it destined to stay a luxury that maybe fragments healthcare access even more, creating a deeper divide?
That is the complex question, isn't it? And the answer really depends on your perspective, how you view healthcare's evolution. From one angle, absolutely, concierge nursing vividly illustrates the future outlook, that accelerating move towards decentralizing healthcare. Analysts agree more care will move into homes. Concierge nursing proves it's feasible, desirable, often effective for complex care outside hospitals.
With potentially positive outcomes like fewer readmissions.
Potentially, yes. Reduced hospital stays, fewer readmissions if patients are better supported at home, a more patient-friendly landscape overall. It shows what's possible with truly customized, attentive care. It also fundamentally underscores and pushes forward that broader evolution towards truly patient-centric care. Its core philosophy, prioritizing individual needs, preferences, comfort, involvement, signals a shift away from system-centric care towards healthcare adapting to the patient.
And that could inspire wider change.
Could do. It might influence innovation in the broader system, pushing traditional providers to integrate more convenience, continuity, personalized attention, forces the industry to rethink the patient experience beyond just clinical outcomes. However, and this is the critical counterpoint, the cost and lack of insurance coverage remain huge barriers to universal access. While it shows us what personalized medicine could look like, it currently delivers it only to a select few.
So the challenge is democratizing it.
Exactly. How do we take these benefits, the personalization, the home-based convenience, the high-touch aspect, and innovate, scale, fund them so they're genuinely accessible and affordable for everyone, not just the wealthy? Can we apply these principles universally without creating an even bigger chasm in healthcare equity? That's the profound, unresolved question.
So what might it mean for the future of our public health systems if personalized, at-home care, arguably the gold standard, becomes accessible only to a select few? And how might we as a society begin to bridge that potentially widening gap in access and quality? That's a really powerful and essential question for you, our listeners, to consider as you reflect on this deep dive into the evolving world of concierge nursing. It's a truly fascinating mix, isn't it? Luxury, medical innovation, profound societal shifts, and really deep ethical considerations about what healthcare could be and maybe what it fundamentally should be for everyone. That brings us to the end of our deep dive today. Thank you so much for joining us. Next time on Trending Unpacked, we head to South Korea, where fantasy, fandom, and faith collide in the bizarrely captivating trend of K-pop demon hunters. You won't want to miss it.